Thank you so much for joining us. My name is Kate Appleman, Senior Clinical Director for Men's Services here at Caron. I'm joined today by Dr. Dean Drosnes. Dr. Drosnes is our Associate Medical Director here at Caron. He also oversees our chronic pain program as well as our opioid addiction program. Today we're going to talk about a topic that many of us talk about very frequently. It's a part of our news, our media headlines. Our president is speaking about it, and it's opioid addiction and the epidemic that we have in our country. In 2016, this past year, 64,000 deaths from overdose from opioid use, 78 people per day. So it's a topic we really need to be talking about, and I'm glad to spend a few minutes to talk about that here today. So I actually want to start with a story, and it's a typical story that Dr. Drosnes and I frequently hear. From many different patients, and we hear the story of a gentleman who in high school suffers a sports injury, really great basketball player, really great football player, just a natural athlete, suffers an injury and is not ready for his career to end. He's placed on opioid medications, and that helps him through his surgery, starts physical therapy, and discontinues the opioid medication. When he gets to college and gets a scholarship to play college ball, his pain starts to act up again as he's trying to play Division I ball. He gets put back on a prescription medication, and that medication continues. The doctor has concerns about how long he's been on it. He starts getting it on the street. It ends up being pretty expensive, and it's just snorting heroin, which is much cheaper. And that turns to sometimes IV use of medication, of heroin. And then we see people here in treatment with a severe use disorder. Typical story that we hear pretty often. Dr. Drosnes, can you talk a little bit about how did we get here? How did we get here?
Sure, thank you, Kate. Unfortunately, we hear stories like that all too frequently. And the athlete who gets an acute injury, whether it's a broken ankle or a broken clavicle or a torn hamstring or a typical sports-related injury, is treated with opioids, and rightly so. Opioids have been used for decades for relief of acute pain. They're very effective, and they really do what we need them to do in terms of calming the patient down a little bit and addressing the pain so that a diagnostic assessment and an appropriate treatment plan can be made. So I think that it starts off, that treatment plan starts off appropriately. The scenario that you mentioned is a person that requires surgical intervention, and oftentimes what happens is that there's a somewhat of a gap between the time of the injury and the time that surgery is performed. So the patient is on opioid medication for a period of time, and then after the surgery, the patient has post-operative pain and needs continued medication. The point is that there's a significant exposure to that opioid medication by not only the body part that's feeling the pain, but the brain. That's where opioids work. So this individual has now had significant exposure to opioids. You painted this scene to show that this person successfully comes off of opioids. And it's important to note that after a few weeks of opioid exposure, withdrawal will present itself. Anybody who takes opioids for a period of a few weeks, when they stop, is going to experience some withdrawal. What does that look like? Well, it's oftentimes gastrointestinal symptoms, sleeplessness, some sweating, some irritability and anxiety. Nevertheless, this young man that you mentioned gets off of opioids and then gets re-exposed as he begins his college sports career. Very, very typical scenario again. The person is experiencing pain, whether it's a new injury or whether it's just that they weren't rehabilitated sufficiently to get back to that level of performance. Nevertheless, the brain remembers, number one, that the medication was helpful for the pain, and number two, may have been helpful for some of the emotional pain that goes along with having an injury, especially in an athlete. So now the this young man is exposed to opioids again, and it may present a problem at this point.
So you talk about the symptoms of withdrawal that happen as just a normal thing that occurs as a result of use over several weeks. How would one know whether it's a medical professional, if it's a family member or a friend, how would they know about misused prescription medications?
Great question. Yeah, as I mentioned, there will be withdrawal as part of opioid use for a period of time, and that speaks to a phenomenon of physical dependence. Physical dependence is the appearance of a withdrawal syndrome once a medication is taken for a while. There are other aspects of misuse of medication that may accompany the withdrawal. Some of them are increasing tolerance, where the medication is less effective at the same dose. And what happens in that situation is people will increase their dose, so they may run out of their prescription early, ask for early refills, or they may go through intermittent periods of withdrawal, which may be witnessed by their family or friends. Or they may start to do doctor shopping, which is going to different prescribers to get medications. These are some of the first and more characteristic signs of prescription opioid abuse.
So we talk pretty frequently, in this case, we talk about pain and the relationship that pain has with addiction. And we talk frequently about the difference between acute pain and chronic pain. Can you talk a little bit more about the role you see pain playing in addiction and recovery?
Absolutely. Very important in this scenario. Acute pain, as we talked about, if it's treated with opioids for a few weeks, patients will have to experience withdrawal, and the prescriber is obligated to understand that and to treat that if that shows up. Pain that lasts for more than 6 months is now considered to be chronic pain. That's the diagnostic criterion, is that it has to last for 6 months. And there have been numerous studies that have shown that opioids are not the best medication for treating chronic pain. There are alternative modalities and different medications that may be better suited for treating chronic pain. Prescribers are, again, obligated to understand that once that mark has been reached, that treatment should change. Pain, as I mentioned previously, physical pain becomes emotional pain, and that has been demonstrated in imaging studies of the brain. So that part of the treatment of chronic pain includes not only treatment of the physical component, but also the emotional component. So the whole treatment paradigm has to change.
So there's a lot happening in treatment all at the same time for someone who struggles with addiction in this way, or struggles with pain in this way. It's not only managing the pain and understanding the pain in a different way, but also really looking at withdrawal management. You know, when you talk about someone who's using just for a few weeks and their body already becomes accustomed to the substances that are going into it. Can you talk to us a little bit about withdrawal management in treatment?
Yeah, certainly. Withdrawal management is crucial to anybody who's using opioids that wants to come off. If it's a short period of time, withdrawal management is relatively uncomplicated and oftentimes successful. Once the person is weaned down on their dose of opioids, they usually feel actually quite better, and alternative pain management techniques are used if they're still having pain. For somebody who has a full-blown addiction, withdrawal management is much more tricky because the brain has been changed as a result of the disease of addiction, and the symptoms are more intense and seem to obviously be alleviated by reuse of the substance. So in full-blown addiction, withdrawal management is crucial because relapse is so common during or right after withdrawal management.
I appreciate you talking about that, because the amount of fear we watch people go through as they're starting to think about the idea of changing and stopping their use, about coming off the chemical, is just so significant. People are terrified to do it. And what's interesting is we watch people do it all the time, and we help people through it all the time. You talked about relapse rates, and I think I read a study recently that about 91% of people relapse directly after detox, and within that first week. And so when we talk about the importance of recovery and what that looks like, not just trying to come off, but really staying off, that it's possible with commitment, right, and treatment. If you had to leave this audience with 2 points about recovery from opioid addiction, what would you say?
Number one is that the medications in and of themselves are part of the picture. Number two, the individual and their genetic predisposition to having a unique effect from those medications is another element. And number three, the context in which the drug is used is another element. So for somebody to really understand whether a person who's taking opioids is addicted or not, all three of those elements have to be considered. So a thorough diagnostic assessment by a knowledgeable addiction specialist or addiction specialty team is appropriate. There's no moral component to addiction. And addiction really is a disease of the brain that results from a unique combination of those factors that I mentioned. So people really should do their best not to be afraid or ashamed of what's going on with them. That's the number one point. Number 2 point is that recovery is possible. And people frequently reach a point where they don't believe recovery is possible for whatever reason. Recovery is absolutely possible, but it just has to be handled in a way that all the components are handled in an integrated fashion.
Thank you so much for being with us today. For more information, if this story really rings true for you, I want you to know that there is hope. There are people out there that can assist you in doing something a little bit different. For more information, visit us at caron.org. Thank you so much. Thank you.
Thank you.